So we're here with one of our patients who has done very well with us, and we just wanted to talk to him about his experience here. So Rob, take it away.
Sure. My previous life, I was a professional umpire, very active, did a lot of things. I was a baseball player, a skier, worked some weeks 80 hours, just kind of crazy. And then I had
Wasn't that your business too? You ran that business?
Yes, ran a business full-time and also was an umpire full-time. So I pretty much had two full-time jobs,
Got it.
working a ton. It was a lot, but I loved it. So it, didn't seem like a big deal to me. When I was 30, I got a pretty massive concussion, 2010, and I went from loving life, doing whatever I wanted to all the time, to just instantly everything changing.
So how'd you get the concussion?
So on a baseball field, umpiring a professional game, and I got hit. I was the plate umpire, and I got hit from the pitcher throwing a ball, fouling off of the batter's bat directly back into me, hitting me square in the face. I had a face mask on, but the impact was so much that it was just one of those, what I've come to learn, 1 in a million type hits, the way it happened. And it just really messed me up. Didn't realize at the time it was that bad. Kept working the game, mostly on adrenaline, and it happened again. So looking back at it, if I'd come off the field, I probably would have been okay within a week or two. Normal concussion thing, rehab, get back out there. Instead, my life completely changed. At first, I could not even put a sentence together. It was very difficult. Fatigue 24/7.
And you weren't even knocked out. It's not like you lost consciousness.
Wasn't knocked out.
Okay.
Looking back at it, I don't remember a lot after that second hit. It was, my memories fade in and out. But I thought I was okay at first, and then I just sort of got back in the locker room and collapsed. My partner said, "Hey, what happened? Are you okay?" And he obviously knew that I wasn't. And in the following hours, days, weeks, which turned into much longer, I was just not right.
So memory issues, fatigue.
Yep.
What else?
So I couldn't drive. If I even drove, I had an issue. It was a pretty major vestibular issue where things would be rushing at me, and I could not judge. I couldn't feel where things were. I didn't know. I couldn't feel where my place in the world was. Driving was basically impossible. Because it was so fast. I just could not judge. I could not feel.
So your eyes couldn't really adjust to anything, and it was just everything was discombobulating.
My brain couldn't put things together. And it was so bad that I couldn't even walk just on the sidewalk around the neighborhood. Like if someone was just walking towards me, vestibularly, my system couldn't handle it. So things like I would try to go out walking just a couple blocks to Starbucks and back. By the time I'd get home, I would fall on the floor and be out, just have to sleep. Working on the computer, it was very difficult. I found that my eyes couldn't converge correctly. And just even working on the computer, at first I could only do 5 minutes at a time, and I'd have to take a nap. Couldn't work effectively. I would try to get through things. It wouldn't happen. So yeah, very, very screwed up. Did not know how to deal with life. Could not really deal. So went on. I saw a lot of different doctors over the years. A few different neurologists. Had one doctor that helped me try to converge my eyes more, an eye doctor.
Is that Dr. Jacobs?
That was Dr. Jacobs. He helped me a lot.
Mm-hmm.
And I basically got to the point that from 2010 to 2016, I did make progress and was somewhat better. I learned some correct medications to take, but my life was still not right. I, at that time, really couldn't do my job anymore, at all, and didn't really know what I was going to do with my life. I was at the point where my neurologists, my doctors were like, look, you're never going to be even close to the same as what you were previously. We're trying to manage your pain here. It was very hard to deal with, but after so long, I don't want to say I accepted it, because I don't like to accept things. Like, I feel like I want to always move forward, do better. But after so long, it's like you get to the point, it's like, okay, this is what it is. It's how you're going to live, how you're going to deal with life. You have to learn how to not work 24/7, not be able to go out with friends a lot, just, have a different life where you're mostly sleeping and not thinking at a high level. So it was around that time my insurance would not pay for things anymore, which was a whole nother issue that probably don't want to get into too much right now. But essentially what happened is that I thought that maybe I could try some different kind of treatment. Things that maybe I would have never thought of, that the insurance maybe wouldn't pay for. So fast forward to 2016, and my wife's good friend of my wife is a therapist, and she had run into Lisa Klein with Total Health, and said that she helped her just in one day, just was like, oh my God, I can't believe what happened here.
Yeah, she was at a class that I was teaching in Baltimore, I think, or Towson.
Yeah, I think, it was like
yeah, she was a student in the class.
Yes. And she told me about Lisa, and I said, well, yeah, great, let's do it. So I came in, and within a few weeks, got an appointment, came in, saw Lisa, and the first session, it was like, holy crap, what is going on here? Like, I could feel that things were sort of opening up, even just in that first session.
We opened up his drainage.
Okay, drainage, right. I still, after a year or whatever it's been, I don't understand it all, but, I'm not a scientist, I was an athlete, business person. But from the jump, it was like, something is happening here. Something different is happening. I'm feeling different.
And all we did is we had our hands on your head, and we basically opened up the drainage of blood out of your head. Because from a frontal hit like that is one of the most common things that happens, is it locks down the drainage, and you end up with this tremendous amount of pressure on your head all the time, causing all these problems. So that's all we did for the first hour. It was pretty awesome.
Yeah, so the biggest things were, before I came in, I had a headache 24/7 all my life. That's just how my life now goes. And I had a spaciness that I couldn't think clearly. So between those two issues, it was hard to even go through life at all. Even when I wasn't working, it was hard going through life. So that first day things started opening up, and it was, I mean, I couldn't believe it at first. Like, I don't know what exactly Lisa and
It was Joe. Yeah.
and Joe, yeah, Joe was doing at first, but it was helping. And I got out of the first appointment, and it was like I had a different life. Just a different life was starting at that point. And I had been through so many different various therapies, treatments over the previous 6 years that I tried not to get too excited about it, but at the same time, it's like something real is happening here. So I ended up, I obviously was going to stick with it, and Lisa and Joe were confident that things would continue to work. So I probably did 2 or 3 hours a week for the first couple of months, and I just kept getting better and better and better and better. It was nuts. I mean, it was the kind of stuff that my neurologists that have, they have their place. They help me with different things. They help me with medication. They help me figure out vestibular issues, converging my eyes. All of those things helped. I am not taking anything away from that, but it was this, once I started doing the manual therapy, that everything just light speed started getting better. And I had my current neurologist that I still see, Dr. Jacobs also, amazing doctors. And I would talk to them from time to time, and they said, well, I think the biggest jump in where we saw when you started really making progress, getting way better, was when you started doing the manual therapy. And it's like, yeah, I think it's that timeline. And because what happened is, in the other treatments, I started getting light years better too. So I had been seeing Dr. Jacobs, I think at the time, about 6 months to a year. And I'd been making progress, but not a ton. And then all of a sudden, I just accelerated. And
when I talked to him, he said it was the day when you came in for your first session.
Yeah.
That day you had like the best visual session you had ever had with him.
Yeah.
It was awesome.
And
it was very cool.
And getting that convergence right, that just helped everything, in the grand sense of it. I had one day that I'll never forget. It was probably 2 months into doing therapy with Lisa that it was a Tuesday. I remember I had my normal appointment every Tuesday with Dr. Jacobs, and I saw Lisa that morning, and I felt better to a degree after that appointment, but I didn't know exactly what it was. So I started just going around. I just started walking around, feeling good, and I stopped for a second. I was like, wait a minute. I feel better than I had. Like, it was the first time in, I guess at that point it was 6+ years, that I sort of felt like myself. I didn't have pain. I was seeing somewhat clearly. I was thinking, like actually analytically putting things together for the first time. And it was almost like I was seeing the world in high def again, where before I was like it was like black and white. Like, it just, something changed. And I remember feeling so good that I called. I never skip appointments. I hate that. I think it's the terrible thing to do, for so many reasons. But I remember calling Dr. Jacobs' office, and I said, look, I understand you have to charge me for today, whatever. I feel so good. I need to just go out and experience life. And I did. I went into the district and did some sightseeing. Went out to a nice meal, hung out with my wife, like talking intelligently about things. Like, it was absolutely nuts. And I remember that day better than almost or maybe any day of my
Wow.
life, because it was just something changed.
I don't
you
think
know?
I've heard that story. That's a great story.
Yeah, it was somewhat early on, and
Mm-hmm.
the crazy thing about it is, I mean, that was probably a year and a half ago at this point,
Yeah.
and how much better I am since then.
Yeah.
It's just unreal to me, like the progress that I've made. Where I had these medical doctors, these neurologists, these eye doctors, that say that I was not. It just wasn't going to happen. That was not going to happen.
Mm-hmm.
I could not get back to that point. And still, even today, I don't know that I'm back as good as I was before. I can't tell, but from when I got hurt, and then specifically since I started coming in to see Lisa, I have a real life again. Like, I can work.
Mm-hmm. You went to school. You did the class at school.
I did a class. I'm trying to decide right now, like, what I should do next, because I don't know. I could maybe go back to school. I could. I'm working full time again, which is amazing in and of itself.
Mm-hmm. You went to New Zealand. You rode roller coasters.
Yep.
You've been traveling.
Yeah.
Everything.
Like real things.
Yeah. Like riding roller coasters.
Yeah, riding a roller coaster that, like trying to do something like that when I first got hurt. I mean, I probably, if I had done one roller coaster at the time I got hurt, I would have had to sleep for 2 weeks. Like, it was that difficult. And now, I can do things like that. I'm still making progress. I think I'm still going to make more progress.
Mm-hmm.
And it still is moving forward, and I'm still feeling better as time goes by, which is amazing. So I don't know exactly how far I can get, but I mean, if you could have told me a couple years ago that I would be at this point, I would have said, my neurologist would have said, my wife would have said, there is absolutely no chance.
So what percentage back to where you were before do you think you are now?
It's
80 is hard to say.
It's a question that it's almost like it's a moving goalpost, because I don't know. I don't have a reference from where I was before
we need to ask your
I was
wife.
injured.
Is what we need to do.
Yeah.
I bet your wife would do.
And it's been so long, I don't know that she knows either, because
because it was 6 years.
It was so long ago that there were points in my life that or in the last 5 years ago that you could have asked me then, and I could have said, oh yeah, I think I'm 80% back, but I didn't know what 80% of what was.
Yeah, totally.
So like, right now, I could say, well, I'm, like, based on that calculation, I'm 200% back.
Right.
So
you can work full time, you can travel, you don't feel like you're back to running, like you don't feel like your movement is restricted at all, really, at this point. Is that right to say?
Yeah, lifting is still hard.
Okay.
There are things that I have to be careful with.
Uh-huh.
But being able to live my regular life, I do, which is, I was so far from doing that previously. No one thought I would get back to this point.
Right. Well, this is the thing that's so striking to us as practitioners, because all we've done for you is really work on resetting all the fascial tissue in your head from all the bonks in your head that you had. Right. And it actually, don't take this wrong, it wasn't that hard to do. Like, you are not one of our most involved patients. Like, we didn't even prep you that first visit.
Right.
There was no prep. We just went right in and opened up that vein, and it was like, boom. And then we prepped you. But you tolerated it, which was great, because, again, that could have gone bad, but it didn't.
Right.
But anyway, nothing really goes bad. Moving on.
Yeah.
So, basically, what's been great to see is that, it's just, systematically going through and opening up all these tissues and getting everything to reset and going injury by injury and getting everything. Remember, you had like with your leg and your back, like other things kind of came up with the course of treatment.
Yeah.
But you've continued to make progress the whole time, which is really awesome. And this is why I wanted to do the video, because there's so many people that are where you were, and it's not okay.
Yeah,
like it's not okay, because it's actually not. Sometimes obviously it takes more effort, but when you work with the structure and you open it up, it's actually not that hard to turn something like that around. And it kills me, and it's just so awful that so many people are suffering and they don't know that there's an option to help you out, which is pretty cool.
Yeah.
So
the pressure thing is probably the number one thing that happened that first day, and then continued, is that I would have this. It was like beyond headaches. It was like this pressure in my head that it was almost like inflating a balloon as far as it could go, and just continuing to inflate, and having that pressure in my head and never having any relief.
And that's the thing, because your MRIs were normal.
All clear, yeah.
See, this is again what the problem is that you can have an enormous amount of problems in the head that are not going to show up on MRI, because they're vascular and they're flow, they're pressure flow problems. So MRIs don't pick up everything at all. So they're great to pick up like an AVM or an aneurysm or something that's really torn. But the pressures that come and go like that, that's not going to show up in an MRI.
Yeah, there was nothing.
So, and this is, again, what's annoying is because so many of our patients come in and like, well, the MRI was clean, which means it means you don't have a tumor, you don't have anything terrible. But that's not really that helpful when you're having all these terrible problems. So, yeah.
Yeah, it was crazy to me that, when I first got hurt, I was like, well, okay, I'm going to get better, right? Like, that's how things work. You get hurt, you get better. And it just didn't. And the pressure stayed. And from that amount of pressure and those headaches, you can't think clearly. And analytically, it was hard to, I was always very good at math, and I just couldn't even do basic math problems. And so the two big issues, the pressure and analytically, putting things together, I don't know if they ran hand in hand, or
well, they do, because if your brain isn't draining fluid very well, because again, the blood flow to the brain is very deep and very well protected. Blood flow out, not so much. It's in the dura, and it's very superficial. So when people have concussions, that's what gets nailed. So with all of our patients coming in, no matter what they're coming in, with headaches, whatever, we always open up the drainage first. You have to do that. And often that's why our patients from the beginning are like, oh, I feel so much better.
Yeah.
Because the body is actually designed fairly well. Again, the blood going in is very, very deep. The blood going out, not at all. So yes, and when you have, it's like a bathtub or like something that just can't drain, then the brain and the other tissues there are going to be not so happy, because they're going to be, again, under that level of pressure, which is not to say you have increased intracranial pressure that you need a shunt or something. It's not that bad, but it's bad enough that you're having functional problems from that.
Yeah. Crazy. Yeah, crazy where it started, crazy where I am right now. Every now and then I'll have a bad day, and then I'll start thinking about it, and I'm like, wait a minute. Even this bad day is light years better than my best days were a couple of years ago.
Yeah.
It's been, I can't believe it was that easy, and nobody else knew how to do this. It doesn't make sense to me. It's been unbelievable. I can't believe where I am right now. So, I don't know.
That's great.
Yeah.
So we're super happy that it's been so helpful, and you've been a great patient, and we look forward to continuing to help you get better. And again, we just want to make the video because there are so many people suffering, and they don't know that there's necessarily another option besides meds, and that there is something that can be done to actually fix the problem, which is what we do. We focus on making it unhappen. So I tell my patients, if you believe that having physical trauma can hurt you, you have to believe that we can put our hands on and basically reverse that out. And that's what we focus on doing. So thank you, Rob.
It's been working, yeah.
Yay!
Continue, yeah.
Thank you for being so open to doing a video for us.
Yeah,
Thank
absolutely.
You.
Happy to do it.
Thanks.